Hello again, everyone. I'm Mike Jones, and we're back here for tip number 29 in our MET 101 ebook series. Now, please make sure you go over to MET101ebook.com, download your copy. These are our 101 most common questions we've answered over the last 30 years for medical exercise professionals, and I think you'll find these tips will help you build your medical exercise training practice. So we're on tip number 29 here. Can I work for a DC chiropractor or RPT, registered physical therapist? Yes, you certainly can. Now, you can either be an employee where you're actually the one of the rehab aides or the exercise technician, that's fine. Or you could be a contractor that's coming and providing the services, but make sure if as a contractor, you're still under the auspices or the supervision of that licensed medical provider and they're directing the care. You're administering care to their patients as a member of their staff. Now, if you are a outside contractor and you're coming in seeing your clients there, then you're not part of their staff. They are your clients, and now we have to be very, very specific about how you're seeing that client and making sure you indicate to the client they're not receiving any physical therapy. But please, if you would, let me read the tip real quick. As a medical exercise professional, yes, you certainly can. As I mentioned earlier, many MET professionals start out working as rehab technicians in a physical therapy or chiropractic clinic. We've seen that across the United States and all over North America. You may use this opportunity to establish connections and referral sources to build your practice. As an employee, you can work under the supervision of the physical therapist or chiropractor, working in conjunction with his or her staff, managing the physical therapy or chiropractic patients. This gives you a great opportunity to learn exercise techniques you will use when you open your own facility or go out on your own with your own practice. If you work with a referring therapist or chiropractor enough years, they will trust your judgment and start referring clients to you outside of the facility after these individuals have been discharged. As I mentioned earlier, this is a springboard for many of our medical exercise specialists to build a profitable practice. An important point here. When you work in a physical therapy or chiropractic clinic, particularly in a physical therapy clinic, you may find because of Medicare guidelines, you're unable to work with Medicare patients. Now, that's even if you're a staff member. Medicare has guidelines restricting non-licensed staff members from working with their patients. You will run into this when you work in a physical therapy clinic. It is a restriction Medicare has put in place to ensure services are provided by licensed medical professionals. You can work with these clients on an MET basis after their discharge, but clients may have to pay out of pocket. So please make sure you understand. If you're working with the physical therapist or chiropractor and you're a staff member, you're under their supervision. So you're part of their staff, you're an extension of them. So now you're providing these medical services. If you're a contractor that is bringing your clients in or you're working separate from the staff, then you have to be very careful to make sure it is very clear cut. You're providing exercise services, not any physical therapy or chiropractic services. And I think that that's very important that you understand it too. And if you're an individual where sometimes you're working with contract clients, sometimes you're working with physical therapy patients as an employee, you need to be very, very clear about that and make sure the therapist you're working with or chiropractor is very, very clear and make sure they differentiate between the two because that can cause some problems. So with that, make sure you go over to MET 101 ebook, download your copy, and we'll see you for tip number 30. Take care.